All right, everyone. So this is going to be the recording on drug recognition and kind of like recognizing and being able to name medications that you might find on a drug list from a patient at home. I've gone through, there's no content for this, there's no slideshow, so this is mostly notes that I've written up based on the drug recognition guide that's in the Moodle folder. So if you haven't downloaded that already, you should download it. I think I sent an email with some of the ALS medication guidelines that I sent out maybe about a month ago. So there's a few other documents in there. Again, they kind of revolve around some tricks and tips that you can use to try and help yourself memorize which medications are used for what. Unfortunately, the list and the kind of conventional naming schemes for a lot of these medications don't really follow through for every medication. So some of them, unfortunately, you're just going to have to know and be able to recognize. I have also taken the time to go over the test. Unfortunately, I don't really think it's going to be super. The test material isn't going to be very conducive to really displaying a thorough knowledge on the actual medications, naming schemes, and schedules. So I might try and change that. I've put some information in here based on the test, but I think as I've been trying to go through that, it's not really going to be very intuitive, and it's not going to be really a good display or a good gauge on your knowledge of the medication. So it might get changed, or I might actually get some questions removed from the test because it's not, I don't think it's going to be very appropriate for this level of content right now anyways. Anyway, so if you're looking for a piece of material to follow along with, the best thing I could say would be to use the drug recognition guide. Other than that, I will send this slideshow out so you can follow along with that however much you want, or use it however you want. So I've basically split it up into the major categories that are presented in this handout. The first one's going to be ACE inhibitors. And the easiest way to remember what an ACE inhibitor is, or which medications would be ACE inhibitors, is by looking for the pril suffix. Let's see if I can get this to work here. So right there, it's not going to disappear. Perfect. So prils, you got medications that are going to be like captopril, ramipril, perindopril. All of these medications fall under the ACE inhibitor class. And if you remember from when we talked about shock states, the reason why they're called ACE inhibitors, if you remember from the renin-angiotensin system, there's this portion of the cycle that revolves around ACE being produced by the lungs and somewhat from the kidneys, and it's what's used to help determine if our blood pressure is low or if we have potential shock states that are presenting. So what ACE inhibitors are going to do are actually prevent this ACE enzyme from converting our angiotensin 1 into angiotensin 2. And if you don't remember, angiotensin 2 is actually what's going to cause all these other effects on the body. So aldosterone, fluid reuptake from the nephrons, vasoconstriction, sympathetic activity. So by inhibiting the ACE enzyme from converting angiotensin 1 into angiotensin 2, we're effectively keeping blood pressure low. So ACE inhibitors are going to be antihypertensive medications or cardiac medications. Now, alpha blockers, I just put the alpha blocker, like the little symbol for alpha in there. These are signified by OCINs. These aren't seen very often. You can see them sometimes if you have a patient with what they call benign prostate hyperplasia. So that'd be an enlarged prostate where they're having difficulty urinating. But these medications are preventing norepinephrine from causing vasoconstriction, which will help reduce blood pressure. Another side effect, though, is it's actually relaxing muscles in the urinary tract, which is going to allow urination to be a little easier. So patients that have urinary retention, or like I said, prostate hyperplasia, where their prostate's gotten enlarged, alpha blockers like this will actually help those patients urinate more easily and more frequently. So much like ACE inhibitors, we have angiotensin 2 receptor antagonists. So antagonists, we should remember this terminology when we're looking at opiate antagonist, so like Narcan. It's going to prevent those receptors from being activated. So in much the same way, if you remember with this graph we just looked at, where angiotensin 2 comes into play right along here and affects all these different organs, angiotensin 2 receptor antagonists are also going to prevent those same functions. So we're going to have reduced systolic blood pressure. Vasodilation is going to be increased, so we're not going to have that vasoconstriction. Sympathetic response is going to be reduced, and these are denoted by the sartan suffix at the end. So you have medications like candesartan, valsartan, telmisartan. Those are the big ones. But that's the kind of the trick for that one. The ending of that one is a sartan. So the next group of medications we're going to talk about are antibiotics. These tend to be a little bit more tricky to find a naming convention to follow. There's a lot of different prefixes and suffixes, and even some antibiotics that don't really follow any of those conventions. The most common ones you'll see are syn, psilin, cyclin, and rif, which would be a prefix. But you can think of medications like amoxicillin, cephalexin, clarithromycin, erythromycin. Some of these you might have been prescribed before for an infection if you've had one. A big one is like doxycycline for like acne and stuff like that. Amoxicillin is big for pneumonias, kind of infections. If you have kids at home, a lot of them get prescribed amoxicillin. Ceftriaxone, you might have heard. It's kind of like a broad spectrum antibiotic. They'll usually prescribe that if they're not exactly sure what the infection is being caused from. So looking for things like these prefixes and suffixes will usually give you a pretty good hint if that's what you're looking at as far as a medication name. Typically, too, when you're looking at these medications in the home, they're not going to be in a blister pack. You'll find these in a bottle because they're not really ever prescribed on a long-term basis. It's usually a short regime, so a week or two sometimes, depending on what the actual infection you're looking to combat is. Antibiotics are prescribed based on the actual type of bacteria they're looking to fight as well. So two of the big things are gram-positive and gram-negative. I'm not going to get too much into it. The big difference is when you look at the actual cell walls of the bacteria, a gram-negative bacteria has basically 3 layers. So you got the inside cell wall. You have a middle layer, what's called a peptidoglycan layer, which is basically a really strong kind of protective barrier. And then there's actually another membrane on top, which actually houses some proteins and stuff like that, which allow the bacteria to signal. And then the other type of bacteria, or one of the types, or say there's only just 2, but would be a gram-positive, which only has the 2 layers. You have your inside cell wall, and then you have a very thick peptidoglycan layer, which is like a thick protective membrane. So obviously, to fight these 2 different types of bacteria, you'd have to use different medications, different types of chemicals to help combat them. And the trick is basically with these antibiotics, a lot of times, is they're preventing the synthesis of these cell membrane walls. So it basically causes the bacteria to disintegrate, and they can't keep splitting and growing. So that's how antibiotics typically work. Another thing you can look at too with these is they're typically prescribed based, like I said, on the actual bacteria they're looking to fight. If they're not exactly sure what type of bacteria they're fighting or what exactly the bacteria is, you might see a patient prescribe some kind of broad spectrum antibiotic. Whereas if they're very sure and they've been able to identify the bacteria they're fighting, they'll prescribe a narrow spectrum antibiotic. Another important thing to remember with antibiotics is they're not going to fight any kind of viral infection. So they're not antiviral medications. They only specifically work just on bacterial infections. Next, we have benzodiazepines, or as they're commonly referred to as benzos. These are typically used to treat insomnia. They're those agitated patients, the ones that maybe need to sedate. And they can also be used to treat seizures or convulsions, whether it be from epilepsy or any other kind of a neurological issue. These are typically denoted by the suffixes azepam or azalam. Big ones that we see all the time or we use as ACPs is midazolam. You could see other ones like oxazepam, temazepam, lorazepam. There's tons of them that are out there. And these can also be used to treat a little bit of anxiety as well. They can be given in smaller doses to help treat those kind of anxiety episodes or panic attacks. So there are a few different uses for these. They've also been used. You might, if you pick up a patient who's having a seizure or they're in a post-ictal phase, sometimes these lorazepam medications, they can give them like a sublingual tablet, which dissolves and helps resolve the seizure. So again, somebody who's prescribed these medications, you might be asking, do they have a history of convulsions, seizures, panic attacks, stuff like that. Beta blockers, denoted by the S of B, like the Greek letter B for beta blocker. These are denoted with the suffix lol or olol. You could probably just remember lol, would be easier. So you'll see this, the big one that we see all the time is atenolol, bisoprolol, metoprolol. These are your beta blockers. So again, these are medications that are going to be used for cardiac problems. So if you're blocking beta receptors, remember you're going to want to think of, there's other systems that also use those, but the primary reason why they give a beta blocker is to slow the heart rate, slow the contractile force, cause some vasodilation, relax all those beta receptors, right? So again, right in here, that's what I wrote down. One thing I did add down here to look at when you're looking at overdoses or potential new patients that are using beta medications is that we also have beta receptors in our respiratory tract. We have beta receptors in our, it's not beta receptors, but beta cells in our pancreatic tissues. So sometimes when you look at new doses or overdoses of medications, you might have other effects through the body that you might not initially think of. You might have things like respiratory distress from bronchoconstriction. You might have reduced pancreatic output from your beta islets not functioning as well due to beta blocker overdose. So one thing to keep in mind when you're looking at overdoses potentially, and I wrote down here too, keep an eye on your blood glucose, respiratory effort, and obviously your cardiovascular levels when you're dealing with beta blockers. Biphosphonates, so these are typically used to treat osteoporosis or I don't want to say just osteoporosis, but low calcium levels or degeneration of bones, whether it be from osteoporosis or another reason. Basically what this is going to do is if there's a shortage of calcium in the bloodstream, it's going to prevent the body from breaking down the bones to achieve that calcium. It's usually given alongside some kind of a calcium supplement. So if you remember from your A&P, your osteoblasts are responsible for that bone breakdown. We talked a little bit about it with the endocrine system. These are going to be denoted with the suffix dronate, or dronic acid will be in the name. Risodronate's a big one that you'll see very often. I can't really think of other ones that I've seen. Clodronate, they say in the list here. Pamidronate. Again, you'll just want to go through the list and kind of, probably the best way to go through these would be to find somebody else and, read them off to each other and try to pick out the prefixes or suffixes and identify the medications. So next one we're going to look at is calcium channel blockers. If you remember from your A&P of the musculoskeletal system, all muscles use calcium in order to cause constriction as part of the myosin filaments, and they use calcium to basically walk down the bridge and cause vasoconstriction or constriction of the muscle. These medications, calcium channel blockers, which are going to essentially block the calcium from entering the cells, they're denoted by the suffix dipine. Big ones that we always see is amlodipine is a huge one that's very frequently prescribed. One that we've seen more recently is nifedipine. And these are going to basically reduce contractile force of the heart, and they're also going to cause vasoconstriction in your vasculature. So reducing vascular pressure and also reducing that ejection fraction force, so going to help reduce that systolic blood pressure as well. Further on down the list here, they didn't really have a great grouping of this on the on that sheet, so I added it myself. I kind of put it in the antidepressant, mood stabilizer, and anticonvulsants category. The big one that you'll find is called phenothiazines, right here. And no surprise, they are denoted by the suffix "ine." There's also pram medications. So some of the big ones we see quite often are citalopram, escitalopram, sertraline, mirtazapine, quetiapine. And then there's always the weird ones, right? Like trazodone and gabapentin. They don't really have any convention, but these ones you'll see pretty often as well. So I put them on the list just because they're pretty important to know. Okay, we also got corticosteroids. We talked a little about this in the endocrine system as well. These medications are going to be denoted with the ending or the suffix of zone, sonide, or solone. The big one you can think of right now that I think everyone should be looking at a little bit would be dexamethasone. That would be your steroid you give for the bronchoconstriction directive. But there's tons of them. There's I don't even want to pronounce them. It's hydrocortisone. Those are a big one that people use for like inflammation in the shoulder. It's an injection you usually get. Prednisone is a big one people get for if they're on any kind of transplants or if they're on like chronic infection. Prednisone is also prescribed for chemotherapy and cancer medications. So yeah, the big ones you want to find are zones and sonide are the huge ones. Solone is usually kind of a derivative of the other one. So I'm not saying don't know it, but these are the two major ones. They're the top ones. And again, if you don't remember what a corticosteroid is for, it's for more of a chronic reduction in inflammation. So it's going to work more long-term than say a antihistamine or something like that. Next one is 5-HT3 antagonists. This is another medication we give in our ALS kit. It's denoted by the suffix cetron, so ondansetron. This is basically preventing activation of these receptors in the brain. These receptors, HT3 receptors, cause nausea. So these antagonists, again, if you're thinking about Narcan and opiate antagonists, they're going to go to those receptor sites and prevent the activation of them and prevent that nausea. So the next two I kind of lumped together because they seem to work similarly, but they're different. So kind of a little bit of a minor difference, but we can probably describe them both at the same time and it'll make a little bit more sense, I hope. So the first one is H2 blockers, so hydrogen blockers. And if you don't remember, when you think of chemistry, your pH is per hydrogen, right? So H2 blockers are going to reduce the amount of hydrogen ions that are being released into the stomach, which is going to help keep the pH up a little bit. So it's going to reduce acidity, which is going to help with acid reflux. That's what these medications are for, right? So esophageal reflux and ulcers. They're denoted by the suffix -tidine. So the big one we see is famotidine and ranitidine. We don't see these ones as often as the next group down here. Quickly, I'll just talk about how these work, though. They're basically blocking the binding of histamine to receptors on the outside of these cells. These are called parietal cells in the inside of your stomach lining. The parietal cells are actually what are responsible for pumping out hydrogen ions into the stomach fluid, making it more acidic. So it prevents the binding of histamine to the actual outside wall of the cell and preventing the production of more hydrogen ions. The next one is proton pump inhibitors. So hydrogen ions are considered a proton because it's got the positive ion tied to it. And in the cell walls of these parietal cells, there's an ATP pump. So it's a little thing I've written here, and it's in blue. Doesn't look that great, but I just wanted to keep it simple. And what these pumps do is they'll actually take potassium from the inside of the stomach, and instead it'll switch it out for a hydrogen ion and pump that out into the stomach, making it more acidic as well. So what proton pump inhibitors are going to do, they're actually going to stop the functioning of that whole mechanism altogether. These medications are denoted by the suffix prazole. Big one we see all the time is pantoprazole. Omeprazole is another big one that we'll see. Rabeprazole is a huge one that we see quite often. So I imagine you could probably have both these prescribed at the same time if it was somebody who's having really chronic problems with ulcers and, acid reflux. But the one I tend to see more often is your PPI or your proton pump inhibitors. So our next one here is our NSAIDs. Hopefully everyone's comfortable or at least have started looking at the list of these medications. So these are going to be your non-steroidal anti-inflammatory drugs. These are important when you look at giving analgesia medications. It's a contraindication if they've taken an NSAID in the past 6 hours. And then also when you look at our cardiac ischemia directive, right, you got to make sure they're not allergic to any NSAID medications. So having a good understanding of what this list might look like or what medications are actually going to be considered to be an NSAID would help you a lot. These medications are typically denoted by the suffix fen, pro, or ac. So again, these medications are basically reducing prostaglandin levels in the body to reduce pain. That's their kind of, I guess you say, over-the-counter use for them. They're also prescribed, however, for their antiplatelet properties, which, keep the platelet slippery, stop or prevent the growth of a current clot. So remember, when we have these kind of medications, we're not breaking clots down with a NSAID, but we're going to prevent that clot from getting bigger. Another thing to remember when we look at these medications, especially when you look at cough syrups or other pain medications, they'll usually combine NSAIDs with other medications to get a synergistic effect or to help fight a different group of symptoms altogether. So some of these medications you can look at, ketorolac, which is in your ALS kit, ibuprofen, which is in your ALS kit. Other ones that you're not going to see in your ALS medications or might be very common are some, like I haven't even heard of some of these, but diclofenac, etodolac, fenbufen. So there's a bunch of these other ones that are kind of lesser known, but the big ones that you should have known or should know about is ibuprofen, and you should definitely know there's some of the brand names that people take. So you got like Motrin, Advil, stuff like that, right? Obviously, we have ASA, acetylsalicylic acid. Should add that as well, I guess. In your drug guide that's sent to you, they have the list of medication paracetamol. This I haven't seen in Canada really ever called paracetamol. Typically, we all know it as acetaminophen or Tylenol. If you're not really sure, that Tylenol is called acetaminophen. So this is a over-the-counter pain management medication. Again, if you're looking at the American or UK, they'll go with the amol suffix. Usually in Canada, though, you'll see the acete. So medications such as like Robax, Acet. I'm trying to think of other big ones. There's some even that is called like your Tylenol 1, Tylenol 2, Tylenol 3. Those are kind of off. I don't even know what you want to call them. Like they're short forms using like the brand name, but that's usually what people call them, like T1, T2, T3s. These are also made with acetaminophen. So when you're looking at your analgesia directive and you have to have no use of acetaminophen in the past 4 hours, try to take into consideration there might be a compound medication that they're using. Again, when you think of like cough syrups, compounded pain medication. So Robaxacet is a muscle relaxant with acetaminophen. So you want to make sure that you take into consideration that there might be medication that doesn't illicitly just say Tylenol. It might say contains acetaminophen. So take that into consideration. Again, these paracetamol versions of these medications, I haven't seen them personally. They have cocodamol and codidromol. Again, so they might be out there in Canada. I just haven't seen them myself personally. So a group of medications called statins. These are basically going to be your anti-hyperglycemic meds. These medications are used to help reduce your cholesterol levels. Everyone always thinks that the cholesterol, or the reason you get a lot of bad cholesterol, is because of the food you eat. The truth is, a lot of your cholesterol levels actually gets produced in your liver. Obviously, it's based on some of the food you eat. It gets kind of, I don't want to say manufactured, but it gets processed and gets turned into cholesterol and obviously stays in your body. So it's not just the food you eat. It has a lot to do with your liver's ability to produce and process certain fats. So the way statins work is they prevent the actual enzymes in your liver from creating new cholesterols, and it actually will help remove some cholesterols that are already existing. The important ones that it's looking to remove, though, is your is it LDLs, your low density lipases. These are the ones that tend to accumulate inside your vessel walls. They'll create, narrowing of your coronary arteries. They create plaque buildup. So they want to get those cholesterols basically out of the body, and it's going to do that by working in the liver. So again, these are denoted by the suffix of statin. I'll do this one on a separate little. So the next group is sulfon. Oh man, I can't even never pronounce this one. Sulfonylureas. Sulfonylureas. We'll give it that. And when you look at this name or this word, there's obviously the word sulf, which probably doesn't mean anything, but at the end you're going to see the word urea, and that should make your brain think maybe it's something to do with urine. And that's what this medication is doing. It's a medication that's prescribed for type 2 diabetes. These are used to help secrete different types of glucose molecules from the body. So if you have hyperglycemia chronically, typically the body has a hard time secreting glucose and allowing it to urinate it out, because the body wants to keep glucose levels inside because that's what it uses for energy. So these medications are going to actually help promote the secretion of glucose outside of the body and allow the patient to urinate it out. These medications are denoted by a prefix, so it's GLI, G-L-I. It has a bunch in here, glipizide, glimepiride, glycoside. The one that doesn't show up is glyburide, which is one I see pretty frequently. It still sounds the same. It's got the gly, but it's spelled with a Y instead. So if you can just remember the sound, I guess it might help you for that one. Now here's a couple they didn't have really on the list, and I don't know why, because they're pretty important. So I added phosphodiesterase inhibitors. There are a few different versions of them, which I've listed in here, but the big one we deal with in the pre-hospital setting for our medications is phosphodiesterase 5. So these are blocking enzymes. So again, it could be 3, 4, or 5, and some of them are selective and some of them are non-selective. So that's why we're pretty specific when we're looking at if patients have had use of a phosphodiesterase inhibitor in the past 48 hours, right? So I've listed them. PDE3, they're specific to enzymes that affect the heart and the circulatory system. PDE4 is specific to the lungs. They'll cause bronchoconstriction. And PDE5 is specific to the lungs and the penis, which is what most people are using them for, is erectile dysfunction. Obviously, like I said, when you look at the list of how these medications work or these enzymes, there is a risk then that if the enzyme is not very specific, it can cause problems with the cardiac and the circulatory system. So when we're giving our nitroglycerin, which is a preload dependent medication, we obviously want to make sure that we're not going to exacerbate any previous cardiac, what's the word I want to use? I don't say compromise, but reduction in function to the cardiac system. So when you look at PDE5 medications, they're all denoted with the suffix "fil," so FIL. So avanafil, sildenafil, tadalafil, vardenafil, those are all your erectile dysfunction medications. As I've discussed before in a few other chapters, these can be prescribed for other things too, such as like pulmonary hypertension. I think they've been prescribed for COPD as well. Basically, any kind of I don't want to say like very specific hypertensive issues, usually revolving around the cardiopulmonary circuit. Some of the brand names that you might see too are Cialis, Viagra, Levitra. Those are the most common ones that you'll see prescribed. Another one that wasn't on this list is diuretics, which is kind of strange because they are also very frequently prescribed, and they can have a pretty huge effect on the patient's hemodynamics. When you look at blood pressures, their ability to compensate for changes in position. So I added it to the list, and it's also got some, there's some questions on the test about it, so I don't know where they thought you were going to get this information from, but anyways. So these are also known as water pills. They help the renal system excrete salt and water. They're going to help lower blood pressure, and they're also going to lower edema. So if somebody has pitting edema or peripheral edema, they usually prescribe a diuretic to help get that salt and get the water out of their extremities. There's 3 types of diuretics. Well, there's probably more than 3, but the 3 main ones that I've seen are what's called thiazides, loop, and potassium-sparing diuretics. Thiazides work on the distal tubules, and they're basically going to encourage that salt get I always get this part backwards. Re-secreted back out into the tubule and then secreted and urinated out. So these medications are called, they go by the suffix "ides." I think they all do except for a few weird ones, and the potassium-sparing ones we'll talk about in a second. The chlorothiazide, hydrochlorothiazide. This one is usually denoted by HCTZ. You'll see that quite frequently in the pre-hospital setting or in the hospital setting as well. And indapamide. Loop diuretics, they work on the ascending part of the loop of Henle, so where it comes back up into the distal part. And the big one that we see is furosemide. That's a very common medication you'll see prescribed. And then finally, we have what's called potassium sparing. So as you know, when you deal with any kind of electrolyte or fluid shift, the body tends not to be very specific on which electrolytes follow with the water, right? So if we're secreting tons of fluid and extra salts out of the circulation into these tubules, potassium tends to want to follow. But as we know, potassium is required for the cardiovascular system, for ensuring that we have our depolarizations remain the same. It also works in the nervous system as well. So there's some patients that can't spare that extra potassium. So we have these specific diuretics. There's one, amiloride. That one follows the convention. But unfortunately, the one that we use or see quite often, spironolactone, has a weird name and doesn't really follow any convention. So it's just stuck there, having to memorize it just for what it is. Another one that we can see is triamterene. I've never seen that one personally, but I think it's on one of the lists somewhere. And again, so this is going to keep potassium in the body, but still allow it to secrete that water. And so now we get to the kind of weird part of drug recognition or memorizing drugs. There's like these don't make any sense medications. What the heck are these from? And I kind of have a problem with some of these. Not all of them. Some of them are on the list of medications we need to know for the test, and I don't think enough of them are common enough that we need to have you tested on all of them. So I'm going to look at this list. And again, this list I've written down right here isn't even presenting the whole number of medications that were found on the test. I'm going to sneeze, I think. We're good. But I'll go through a couple of them real quick here just so we can discuss them. Some of these, I'll go through them, but my favorite trick is when you look at a list that has a generic and a brand list or labeling next to them, is usually the brand naming has some kind of word or part of the word that relates to what it's supposed to do. And it's because they want you to think of that brand name and be like, oh yeah, that's going to help me with this. So sometimes you can, I don't want to say guess, but you can use a little bit better judgment on trying to determine what the medication's for by looking at the brand name. And on the test questions that are present, they have them both there for these lists. So there's some where you're just going to be able to use the suffix trick and memorize them that way. Some of these, though, I've pulled the ones that I found don't really follow any convention that clearly, and I'm trying to give you a list of them so at least you can try to, think of a trick for yourself or start working on a way to memorize them, because there's not really any clear naming convention for some of these medications. So haloperidol or Haldol, that's given quite frequently in the hospital setting for as an antipsychotic. So if somebody's having a psychotic episode or they're very agitated, they'll get Haldol to help them settle down. I don't really know what you want to use to remember that. Halo, make them act like angels after they get it, I guess. Rivaroxaban or Xarelto, anticoagulant. There used to be a lot of TV ads for that. People with atrial fibrillation were prescribed it quite often. They probably still are. Risperidone. I want to double check this. Risperidone is an antipsychotic med as well. But I think it's also used. No, it's not. It's usually used in the older population to help keep them relaxed. Again, it's people who are dealing with Alzheimer's, dementia. They get agitated and confused. These kind of medications will help keep them a little bit more relaxed and in a not sedated, but I don't want to say sedative state, but anyways, more relaxed. So you can see here, like some of these are just random. Like terbutaline is a beta agonist for bronchodilator. It's airway medication. Trimethoprim, Cetra. This is the one you usually hear used in the medical universe. This is an antibiotic. Cetra is used all the time for UTIs. It's a very common bladder infection medication. You can find some of them. So anticoagulant medications. So you got ones like warfarin, enoxaparin, heparin, apixaban. Ignore that. But some of them do follow some sort of convention. It's just not all of them. So it's very kind of annoying. So here's a good one. So Ambien, for example, I always think of ambient. Like I listen to ambient music to help me fall asleep. It's a sleep aid. Salbutamol, I'm hoping we all know what salbutamol, beta agonist. If you haven't figured it out yet, please go over your ALS list. Some things that are going to be uncommon or not really known about yet for you guys. So allopurinol, it's used for anti-gout. Gout is a buildup of uric acid in the body. They get sore joints. They get kind of like a yellowish tin skin. So if uric acid is basically what's in your urine. So if you imagine that gets built up in your skin, you get a little bit of that jaundice look, that glow. Divalproex, valproic acid. These are anti-epileptic or anti-seizure medications. I don't want to read all of these off to you. I'm going to provide you with the list so you can look at this. But again, I'm going to try and see if I can touch base with somebody at the school and see how tied they are to this list, because it's I don't think it's really teaching you much. It's just going to force you to memorize. If you're successful at memorizing a list, you'll memorize it for a week and then you won't remember it afterwards. What are some other ones here I wanted to look at? So here's anti-hyperglycemic medications. Fenofibrate, that doesn't make much sense to me. I don't understand what that means. But if you look at Lipidil, so if you think of a lipid as fat, triglycerides, these are usually things that are tied to cholesterol levels, right? Here's some good ones for the bronchodilators of respiratory medication. Advair, Oxys, Easy Oxygen. So there's usually silly kind of little gimmies or giveaways that these medications use. Opiates, so Codone, Oxycodone, those should kind of sound familiar, hopefully. Vicodin, if you've watched the show House, he pops Vicodin for his sore leg. Trying to see what else we have in here. Pulmonary system, bronchodilator. This is the one I was mentioning earlier with the antibiotics. So you have Ceph, it's usually S or CEF. This one is CEPH. So cephalexin is an antibiotic. It follows the CEF sound, but it doesn't really follow the naming convention. So if you can just remember that Ceph sound. Arthrotec. This one has the AC at the end, though, like the other NSAIDs had on that list. What else are we doing here? I don't know. Some of these are weird, like domperidone. That follows the naming. Pepcid AC. If anyone's taking anything for heartburn, that's what that's for. And then there's some they want you to memorize that are just kind of mineral replacements. So folic acid is a mineral. It's used for when you're pregnant or to help with osteoporosis. So here's another one with the bronchodilators, right? Vent, your ventilatory system. And then there's some too, when you look at like ADD medications, Adderall. ADD is right in the word. So for ADHD, trying to see. And the nice thing too is if you can memorize a couple of these. So budesonide right here is also up here in this kind of grouped one, right? So if you can remember that Pulmicort is budesonide, and you go down here and you say, budesonide is with another medication, but I know budesonide's for the lungs. You're going to still put it in that respiratory or bronchodilator category. It's fine. Soma, somatic muscles, somatic nervous system, muscle relaxant. Celebrex. See, this is another one, ciprofloxacin. You got your sin at the end. So Cipro is a very popular antibiotic that's prescribed. Voltaren gel, diltiazem. So that's part of the list. There's still like another 2 questions worth of these, and these aren't even all the ones that are on the test. So I'm going to see what I can do about the test. We still have quite a bit of time because it's obviously, we still haven't written our endocrine test yet. So I'm going to look at this a little more and see how I feel we can change it. I haven't had to go into a test and modify it too much yet. So I'm going to see what the options are for you guys, because I don't want it to be a huge like undertaking or this huge struggle to memorize this list of medications that might not be very intuitive or useful for you afterwards. So just to finish off, if there's any questions about this stuff, I know it's kind of, I won't say it's short. It's not really, the whole purpose of this isn't so that we can go through and say how each of these medications work in depth. It's not really in our scope of practice to really know or need to know that stuff. The most important thing with drug recognition is being able to identify why people might be prescribed these medications. So again, there's some off-label use when you look at like phosphodiesterase inhibitors or, what's the other big one that's going around right now? Ozempic, for example, which is traditionally used for diabetes, obviously can be used for fat loss as well. So it's not always going to be, white and black what the answers are going to be for their chronic medical conditions. The whole point is you can look at a list of meds and say they're on metoprolol, they're on rosuvastatin, and they're on candesartan. I can be probably a pretty strong guess that they've had some kind of hypertensive problems in their history. If they're also on something maybe like warfarin or something like that, then maybe they have atrial fibrillation, and that's why they're prescribed the beta blockers to keep their heart rate low. So the idea isn't to be like, oh, well, beta blocker is going to block those beta receptors, which is going to do this, this, and this. It's nice to know that. It shows that you're a good clinician and you're thorough with your knowledge. But at the end of the day, knowing the kind of the medication and the end result of taking that medication and why somebody would be taking those with maybe like another group of medications is what I'm really hoping that you guys take away from this part of the course. Which is why I'm not super fond of the idea of just giving you guys a huge list of these random medications that you might never see again. Because it doesn't give you any kind of valuable knowledge that you can take with you into practice. And I don't think really in a week, or even if I gave you 2 or 3 weeks to look at that list, you're going to really be able to effectively have a good understanding of it or build a good basis of knowledge on it. So my advice right now is to study these first parts here, have a good grasp on anticoagulation medications. They're not on this list, but if you can just Google like what an anticoagulation or a blood thinner medication does, add that, or I can even talk about it after the test next week. But like I said, I'm gonna touch on this list later and see what I can do to maybe make it a little bit more specific or applicable for us as paramedics. I don't think there's really much I can say. I added those few other things here already. So like I said, if there's any questions, email me. I can hopefully get you more answers if there's something you feel like you don't know enough about when you look at this list of medications, and we'll go from there. Okay, take care, guys.